Good afternoon everyone. I am going live today with Dr. Hector Izquierdo, who is from the Alicante clinic at Vida Fertility Institute in Spain. And we're going to be talking all about immunology and fertility, how the immune system plays a role in conception, and I'm going to invite him in now. Welcome everybody, nice to see you today. How's everyone doing today? Live, please feel free to ask. That's what he's here for. The team are very happy to help. So yes, hello, good afternoon.
Hi, good afternoon. How are you doing?
Good to see you. I haven't seen you since we met in person, I believe last year. How are you?
Good, fantastic. Thank you for the invitation.
Good.
And I'm very happy to be today because we're speaking about a very, very interesting topic. One of my most wanted ones, if I may.
Yes, it is a very interesting topic. It's something that I have experienced firsthand personally. So I'm keen to hear Vida Fertility's thoughts on it and of course yours. Please could you start by introducing yourself and Vida Fertility Institute?
So I'm Dr. Hector Izquierdo. I'm a gynecologist and a fertility specialist. I studied medicine both in Germany and did gynecology as well there. Then I started the journey of the fertility also in Germany, but due to the legislation and all the restrictions that Germany offers for fertility treatments, I thought myself that staying there was not an option because the spectrum of possibilities for patients is very restrictive there. So I decided to Spain, and now I'm working in Vida Fertility, which is a center that has a different perspective on how patients should be treated. You know, nowadays a lot of institutes and centers are going in the direction of getting bigger, merging, unifying, and we do think that the idea is a different one. We do believe that clinics focus on patients and individually being treated just from one doctor, one assistant, helps those patients to develop a bit more of a trust and a good communication system that has also benefit on their treatments. And that's why I'm here in Vida Fertility. I have a clinic in Madrid where the medical director is my colleague, Katy, and I'm the medical director.
You're based in Alicante, aren't you?
Yes, I'm in Alicante.
Mm-hmm. And do you see a lot of patients coming over from the UK?
Yes. Alicante is actually a very common destination for UK patients because let's say it very clear. The south and the Mediterranean coast of Alicante, of Madrid, of Spain, is a very common destinations for UK people for holidays and vacations, and that make them know a little bit how to come here. We're very good connected with the UK. The airport is fantastic. So believe it or not, it's easier to come to Alicante than to go to Madrid, Barcelona, or all the bigger cities in Spain. So it makes it very easy for them to come here. We have a lot of connections daily, also in low season, and that makes it very handy for the patients to come to us.
Absolutely. So we have linked up the well, your website, Vida Fertility's website, via our bio. So please do go and check out the team as well for a free consultation. So the topic today, immunology, as I said, something I've experienced firsthand myself. Please could you start by explaining what is immunology and how your immune system can affect getting pregnant and staying pregnant?
So let's start from scratch. So we need to first understand what is the immunology at all, and we need to understand that our body is constantly threatened by different things in our environment that can affect us, called the bacteria, viruses, or just toxics. And the immune system is actually that system of your body who's in charge of protecting us from all those damages that come from outside. To a bit of understand a little bit, we need to know that nature is so fantastic that we actually get pregnant from a baby that's 50% not theirs, because you know at least 50% of the DNA comes from a foreign person, which is the husband, but still foreign for your body. That in that case, sometimes when the immune system is not perfectly balanced, the body of the woman might feel in taking this embryo and accept it as proper and might try to reject it. And
implantation stage, transfer stage.
Or later on, so already implanted embryos can be discarded, and also, let's say, immunological issues might be a problem for repeated implantation failure and also repeated abortion, both things.
Okay. What is that in the first trimester predominantly?
I would say always after week 15, the placenta is well formed, established, and is less likely for immunological issues to be a real threat for the pregnancy, but it still could be.
Okay. So, is there anything that men should be aware of when it comes to immunology? Obviously, they're not carrying the baby, but...
First of all, we need to understand that although that's my specialty, and that's what I do on a daily basis, I don't think that discarding immunological issues in the first attempt of fertility should be a standard procedure. You know, this is not God thanks, so a common issue in fertility. It's not like all of patients going fertility treatments have these type of issues. So many patients ask me, should I make an immunological assessment prior my first IVF treatment? And I say no. We need to understand that all medical treatments and they have to be medically indicated. So if you haven't transferred good quality embryos and failed with that, then the idea of making immunological issues and see if that happens prior treatment, I think it's mandatory. The only exception for that is patients with very low ovarian reserve that do not have a lot of embryos. Then in that case, if we know we have a gold embryo and we are not sure if we're going to be able to repeat this and have another such a good embryo, that in that case, due the reduced numbers that we have, we might make an assessment just to be sure that we're giving this one embryo the best cards they have. But besides that, I don't think this type of studies should be a standard treatment or assessment set in all patients going for fertility treatments.
So when a patient comes to you at Vida, do you talk about immunology treatment for most patients? Or as you said, is it a more personalized approach depending on whether there's been recurrent miscarriage or recurrent implantation failure, for example? At what stage would you have these conversations, and what would be the first step in terms of testing?
First of all, I think fertility treatments are already very scary and very threatening in terms of how women feel about the whole process. And although information is important, providing the patients with information that might not need at the moment may produce more anxiety, more stress that is perhaps not needed. What I do is always make a very, very intensive anamnesis to see if there might be some risk for immunological issues from the very beginning. It's a different thing. 28-year-old girl come to us with a 2 factor, good sperm quality that okay, we understand why you're not getting pregnant.
Yeah.
I think we should speak about that. But if the same patient will start asking and you see that her mom has Crohn's diseases, that his father has had some Hashimoto thyroiditis, that she might have some risk factors, then we would like as well to speak with those patients based on her risk profile, on all those other factors that might be affecting her fertility. So I think the idea is always to build as a professional a good view on the patient as a total, evaluating the risk factors that she may have, and based on that, making the conversation and the consultation fixed to her problematic. There are very small things that should always be spoken about and should always be clarified, but there are other things that do not belong here. For example, I think all patients you need to understand what's an egg, what's a mature egg, what is fertilization, which techniques are available for that, what is the culture options, why is a biosynthesis culture better than a normal 3-day embryo culture. Well, those things are very important to explain them why cryotransfer are better than fresh transfers. The whole 101 on things. But going that intensive on things that she might not have would just scare them.
Yeah.
And what I always say, and I think you agree with me in these things, is to bring these patients to a comfort, steady state of mind, help them a lot. So I think my responsibility, more than just spewing out information that they don't even take to themselves, is just to guide them to feel comfortable, secure, and to tell them what is the situation that might affect them.
Absolutely, I think that's great advice. It's a kind of step-by-step process, isn't it, as people become more comfortable with understanding options and different protocols. When I had immunology testing done, it actually revealed that I have a blood clotting disorder, factor V Leiden, and that has actually been extremely useful to know for my everyday life, and also for pregnancy following IVF, to know about blood thinners and, you know, postpartum, etc., and for flying and all sorts. So it's interesting how something that has stemmed from fertility treatment has actually sort of, I don't know if helped is the right word, but it's given me more knowledge about my overall health, which for other areas of my life in the future. Do you see that sometimes with patients?
Very, a lot, because and we test to patients who are not really in the age to be going to doctors for other reasons. So many of my patients have never been to a doctor besides fertility. And then it's always a good moment to assess them as a total, and you discover a lot of things that are also important. For example, I do believe that a biochemical test of the patients to see if the blood sugar is good, if the cholesterol is good, if all the rest of her body is also doing fine, is very important regarding starting a new process, because if she's not healthy, then getting pregnant is not going to be easy. And on top of that, if you're not in best situation before you get pregnant, the pregnancy is going to make those previous situations not even better. Then you need to be already informed about what can be happening in the process, so you can pick for yourself all those specialists that you might need to take care of your pregnancy later on.
Absolutely, absolutely. So with initial testing, what should people expect in terms of, you know, how many blood vials are drawn and what that might show them, and then what protocol you might suggest depending on their results?
So principally, there are a couple of things that we think, all of us, that are very important. For example, the metabolism of sugar of a patient is very important in fertility. So asking for a HbA1c or a HOMA index is always very important. Cholesterol problems are also important, because nutrition is very important in fertility as well. The level of function should always be assessed, because we're giving medication, higher dosages of medications to patients, and we need to be sure that this level is capable of dealing with all these things once she's undergoing treatment. The kidney function is also very important, because at the end, all those things we give, they need to be taken out of the body through the kidney. If the kidney is not working properly, then we might be getting the patient under risk. And a simple assess of the blood clotting system is always very important, because, as you said before, blood clotting is dramatically important in fertility. So I'm not saying we need to do all the genetic testing for see mutations and things like that, but you can discover in simple blood clotting assessment if there are some issues that might be treated in the treatment later on.
Yeah, absolutely. And so what kind of protocol would you put people on if there were kind of blood clotting issues or things that showed up in the immunology results?
There's something that I always say to my patients as well. We need to understand that nowadays, and with the knowing that frozen transfers have shown to be better than fresh transfers, we need to divide the treatment in two times. One thing is producing embryos, and for that space of time, there are some things that are important, and the other thing is to transfer, which is a whole different thing and a whole different assess. So for the IVF treatment, most common things is hormonal levels are good. Blood sugar is very important, because high blood sugar reduces the number of eggs that we produce and reduce the quality of those eggs and the number of blastocysts that are going to be produced on that. And then for the transfer is very important, the thyroid, the prolactin, and all the liver enzymes and things like that.
What about things like vitamin D levels?
Vitamin D levels is also a thing that I think all of us should be testing. Why? Because regardless where you live, the amount of sun exposure effective sun exposure that you undergo is always low. We all use sunscreen, we all use long sleeves, we all use all those things, and that reduce the vitamin D that your body can process. And you'll be surprised how common it is to have low vitamin D levels nowadays.
Mm-hmm. Yeah, and obviously being in Spain, you'd have hotter weather, but as you just said, it's not always about just the sun itself.
But
We've just had someone.
if you live in Spain, you protect yourself even more.
Yeah.
And then all this sunscreen reduces the metabolism of the vitamin D as well. So we're exposed to more sun, but we can take care of ourselves more. That makes it that the vitamin D deficiency is also very common in Spain.
Absolutely. Someone has just asked, this is not so much immunology, but about borderline high cholesterol, and, you know, wondering whether to sort of help reduce that before starting stimulations, and asking if they should perhaps start statin, is that right? What's your thought if you get some result that's kind of slightly borderline high? Would you, with your patients, assess and say, maybe let's look at those levels first before you start treatment? What's your advice?
Ongoing. I do think, and I have a bit of a different opinion on this topic as some of my colleagues. Most of my colleagues, they say, well, you need to reduce cholesterol, you need to reduce sugar, you need to make diet right on before we start. And my opinion on that is a bit different because patients who have to undergo a very strong diet, they suffer under that from stress, and the cortisol levels are very high because if their body are adjusted to a calorie intake and sugar intake and fat intake, once you reduce that dramatically, your body senses that something's missing. And this body view saying, okay, wait a second, I'm running out of reserves. I'm taking what I already saved out of my body just to provide the normal maintenance. That might be felt from the body like a threatened. And if your body feels threatened, then the body's not going to cooperate to get you pregnant. So what I always say is, more than making diets that are so strict, reducing sugar or annihilating it out from your body, what I always say is we're going to try to focus on balance.
Okay.
We're going to balance your diet into a healthy one. I don't care if you're losing weight, but if you are eating properly, your blood sugar is going to be better. Mm-hmm. Your of fatty acids is going to be better, and that's going to be enough for me. Because at the end, what doesn't help you to get pregnant is not the fact of you having safe fat in some areas of your body. What is affecting you from getting pregnant is the fatty acids that are in your blood and the blood sugar metabolism if it's improper. So eating properly already rebalance these two things and make it easier and doesn't make the patient feel under that much stress.
I love that advice. When we're talking about the immune system, if someone has just had COVID, for example, which is always at the top of people's minds when you're having fertility treatment, even now, would you say to people, you know, maybe take a break and come back when you've given your body time to recover, or would you just sort of say continue? Like, how important is it to be in the perfect shape?
Advice for COVID and for everything. So at the end, patients coming here after a big surgery, after having a heart disease, so at the end, the patient needs to be in a good situation to do this. First of all. Second of all, IVF treatments are very expensive and complicated to organize. So undergoing an IVF treatment not in the best situation from your body might be wasting one cycle, and we don't know how many of those we can do. So I think it's very important to focus first of all in well state and balance, and then proceed later on. So the patient saying, I just get out of the hospital because I had a very hard infection with flu. Should I start with stimulation right away? I say no, please restart, reboost yourself, and once you're feeling good and you're dismissed and everything's fine, then we'll start this process again.
That's great advice. In fact, someone has just mentioned here, and this brings back a memory I had of a cycle where she had a failed, transfer on day 3. Post-transfer, felt like she was getting a cold and was congested. I also remember having a really heavy cold during stimulation and being really worried that it was going to affect egg quality. Do you think there's any correlation between being sick whilst you're having treatment?
It could be two reasons. So one thing I do want to clarify is that all patients think that the immunological system is a problem for pregnancy, and it's not at all. Let's go to the basics, and it's this way. Most patient thinks that you have an embryo. This embryo develops onto blastocyst, then it hatches out, and then just takes a shuffle, makes a hole, digs itself, and grows. And it doesn't really work like that. It is more like an immune answer needs to be triggered for the embryo to implantate. So, an embryo has from itself HLA antigens, which are pretty much like a key to open the lining. And then from the side of the woman and the lining, they have the NK cells. Those natural killer cells, who have an awful name, are also very important there. So the HLA antigen from the egg, skeleton from babe, that mom, needs to come and accomplish and bind to an NK cell and activate those Q receptors.
Right.
This is compatible if the right lock, the right key come in the right lock and opens and activates the NK cells. Those NK cells are going to go in the lining and remodel the lining, so it is possible for the embryo to implantate.
Okay.
Therefore, if I'm having a heavy infection, it might be two things. One is my immune system is totally high and is rejecting everything what's coming to my body. And the other option might be that your body is too busy trying to deal with this disease, that your immune system your lining immune system is so low that there are not natural killer cells enough to take this embryo, accept it, and implantate it. Therefore, either one way or the other, infections and transfers shouldn't be together.
Right. Okay. So if someone's in that situation, would you say speak to your provider and discuss the plan in terms of timings to see whether maybe you look at a frozen embryo transfer, for example?
And the thing is, you can always freeze the embryos and transfer them later on.
Yeah.
It's actually, this is a misconception that's still so fixed on the patients. So you say it that way, she got a day 3 transfer fresh.
Yeah.
Transferring embryos is something very comfortable for physicians, but very into patients. Because if you transfer a day 3 embryo, you said, I've done my work, I gave you an embryo, but you didn't even know if this embryo was going to come to a blastocyst or even going to hatch out and be able to implantate. So the patient might be thinking transferring day 3 embryos that she's not got pregnant because her lining is not working, when the first instance those embryos perhaps didn't go there.
Okay. Interesting.
So, I think being afraid of not transferring fresh, something we need to take out of our minds.
Yeah.
Because transfer has been proven not to be better.
Sorry, doing a frozen transfer?
Being fresh transfer, it hasn't shown to be better than frozen transfers.
Yeah, absolutely. I've had successful cycles with both fresh and frozen. And you obviously experience both. So it's interesting to hear you say that. If someone
this is not me, so there are huge studies comparing live birth rates in both fresh and frozen transfers, and I'm not saying that fresh transfer have less possibilities of producing a pregnancy. This is not what I'm saying. What I'm saying is that they have better possibilities than a cryo transfer.
Interesting.
To do a fresh transfer, you need to risk other things, that you need to be softer on the stimulation, you need to produce less eggs because otherwise you can produce an hyperstimulation syndrome, you need to be account of the progesterone and a lot of things that are very hard to organize. Mm-hmm. Then I don't see the benefit of risking all those things to be in order just to make the transfer if there's no evidence showing us that it's better.
Yeah, absolutely. It makes complete sense. And of course, like you said, case by case basis. If a patient at Vida Fertility Institute does have heightened natural killer cells, what would you sort of recommend, or what would you prescribe to support that at Vida?
So, NK cells are important, but there's a whole lot of immune cells that need to be balanced. So in the specific case of a patient just having natural killer cells that are high, this patient is benefit from intralipids infusion prior or near to transfer, then after 3 weeks, and then after 3 weeks. So week 0, 6, and 9.
So when would you suggest having intralipids at Vida?
Around the transfer.
Yep.
For the transfer and the day of the transfer, for example.
Yep.
And after 3 weeks, and then after 3 weeks again. So 0, week 3, or week 6.
So 2 weeks after, so sorry, 2 intralipids after transfer as well.
And in 3 weeks, difference.
Okay. Interesting. And do you see a lot of patients who go down this route? Would you say that at Vida you have a very holistic approach to testing patients and supporting them with different types of treatment?
Sorry, I didn't get the question again. I'm sorry, I got lost.
Would you say that you have a holistic approach at Vida where you look at all of these areas, like you just mentioned, testing for natural killer cells, immunology, looking at other blood test results, such as vitamin D, for example, or cholesterol, to piece it together?
Sport, wellness, everything. I think it's always been a bit of a war in between traditional medicine and all of these holistic aspects of life. I am totally against that. I am very aware of how important are all these other details in the treatment, and I always like my patients to get help in those terms as well. I think diet coaching is fantastic. I think fertility coaching is great to help them have a support staff behind them, to work on the psychological aspect of the situation, to make them help them deal better with all the grieving of not getting pregnant, or the frustration is also very important. I think focusing just in eggs and transfers it can be good.
Yeah, absolutely. Do you have time for one more question?
Of course.
This person has said they've been struggling with bacteria in the reproductive tract since January. Antibiotics and probiotics have not worked to get rid of them. Do you have any suggestions?
So principally, we need to understand that all of the studies say majorly that the best lining is that one without bacteria. So that we have to have a clean environment. So one thing that we use very common is to make as I said, cut and plant. So we do an antibiotic cure for 14 days. We try to eradicate all bacteria that are there, and then we settle back all new good bacteria inside of the womb so they can just grow properly and repopulate the environment.
Absolutely, thank you. I see more questions coming in. My suggestion would be, for personalised advice, please do follow our link in bio, speak to the team at Vida, who are very happy to set up a free consultation with you, and you can have your questions answered and discuss next steps. Thank you so much for your time today, Dr. Izquierdo. Is there anything else you want to say to everyone who's watching this or watching this back?
Yes, I think the most important thing is to look for help and look for a professional that you can think it can help you with that. Make some questions. Do not hesitate in contradict your doctors, and make the questions you think is important. All what you've read from those different groups, all what you read from different patients.
Yes.
Be able to ask all those things to your doctor, because there might be a lot of information lost if you don't speak.
Totally. People need to advocate for themselves and ask the right questions, and as you say, seek the right advice from top professionals such as yourself, who can really guide and steer and make sure that things are happening at the right time, and that no stone is not unturned. So I completely agree, and we've had people just saying thank you so much. It's such an important area and we really appreciate your expertise. Someone's just said thank you for your time. It was so nice to see you again. We met in London. So there we go. Please do reach out to the very friendly Vida team. The link is in our bio. Thank you very much for those who have joined, and lovely to see you today.
Bye-bye.
Thanks. Bye-bye.